All right, so that should be clear. Everybody that doesn't know it's being recorded has been warned. So, hello, everybody. Good afternoon or good evening, depending on where you are joining us from. My name is Philip de Man. I'm a research manager at the Leuven Center for Global Governance Studies at KU Leuven in Belgium. It's my pleasure to welcome you all and to moderate today's webinar on regional perspectives, Latin American approaches to rights-based development. So maybe a bit of a background information just on what this webinar is or wants to be, and then I'll be happy to introduce our distinguished speakers. So first, the session that we have today is the second in a series of 4 webinars that wants to explore human rights-based approaches to development cooperation and related issues. And our first session in this series took place last week. And in that first session, we introduced some core concepts, some frameworks, global practices around human rights-based approaches. And today we turn our focus specifically to Latin America. So the idea is that we have now, after the first one, 3 other, so let's say, webinars that kind of each take a regional perspective: Asia, Africa, and then today Latin America. So obviously, Latin America is a region with a long and rich history of, let's say, norm entrepreneurship in the field of human rights, social justice, democratic governance, and so forth. And I think our discussion today, of course, will lead that to the speakers, but it gives us a chance to focus on how, let's say, rights-based approaches have been interpreted and adapted and implemented, of course, across Latin America in a lot of different areas like health, gender equality, and development cooperation. So this series of webinars is organized within the framework of our EU-VALUES project. It's a Jean Monnet Network. It's a collaboration of 21 higher education institutions across 6 continents, including, of course, Latin America, involving nearly 100 academic experts, I believe. And of course, the main goal for this network is to basically enrich the debate and deepen the understanding of values and democracy in the foreign policy of the European Union and its partners, all the while promoting gender equality, geographic diversity, and of course, scholarly excellence, right? So now that that's out of the way, let me introduce our panel of speakers for today. So we have scheduled originally at least 3 speakers, but I'm getting in touch with our third speaker. So the first 2 speakers are luckily here. So first speaker is Professor Andrea Ribeiro Hoffmann, who is an associate professor at the Institute of International Relations at the Pontifical Catholic University of Rio de Janeiro, and also a collaborator professor at the University of Latin American Studies. Her presentation will focus on human rights-based approaches and health. So addressing essentially how human rights principles can guide health policies and strengthen governance structures on that issue in the region. And our second speaker is Professor Tatiana Rein from the Institute of International Studies at the University of Chile, where she also coordinates international affairs. And her presentation will focus on the backlash for women's rights, the threat of conservative policies in the Americas. So we do have a third speaker scheduled for today as well, and I'm going to be reaching out to her in the next coming minutes to make sure she will still be able to join. And that's Dr. Juliana Peixoto, who is a researcher at the Department of International Relations of the Latin American School of Social Sciences, Flexo, in Argentina. And her talk would focus on equity-based approaches in international cooperation projects. Now, each of our speakers will have, let's say, around 10, 15 minutes for their intervention. We're not going to be monitoring the time too closely. We just want to, let's say, have that as a kind of ballpark figure for the duration of the presentation, just so that we have, let's say, time to listen to the presentation, but also, let's say, time for some questions and discussion afterwards. And I suggest we first have our, say, presentations, and afterwards we invite questions from the audience, and also maybe from panel members for each other to have a brief discussion at the end of our 1-hour session. So, and before we now begin, just a couple of brief housekeeping notes, because this is a webinar. So apart from panelists, the microphones of the audience members will be muted. And of course, that doesn't mean we don't want to have you engage with the discussion, but we do ask that if anyone from the audience has questions or comments, just please post them in the chat at any time, and I'll collect them during the webinar and relay them to the speakers during the Q&A session at the end. And if you have a question that's directed towards a specific speaker, please also indicate that, or otherwise, if you want the entire panel to essentially reply to your question, that's of course also possible. So once again, thank you so much for joining us for this second EU Values webinar, and I'm now very happy to invite our first speaker, Professor Hoffmann, to please take the floor.
Thank you very much. Good morning, good afternoon to our guests, audience. And I'll be talking about two caveats before I start. I'll be talking about health, specifically about the issue of health and a rights-based approach to development in the case of health. And also, of course, we are focusing on Latin America and the Caribbean, on the LAC region. And therefore, I'll be mentioning some regional initiatives. But of course, I mean, I'm also referring to a couple of research articles, research that I published, and that doesn't cover all Latin American Caribbean countries. And for that respect, I'm not also focused on CELAC. I think that's important because one of the arguments that I'm putting forward is how diverse also the region is. I mean, making a claim that there is a certain tradition, a legalist tradition, rights tradition that in the region, including international law and rule of law. However, that varies a lot according to country, to the period of time. That said, I think it's possible to see a trend of a certain rights-based approach to health in the region, especially in the last 2 decades and in the cases of some sub-regions. I'll mention that very soon. So I just wanted to refer to these articles, research articles that I'm basing this this presentation. One, because they are also co-authored, so I think it's important. One is from a chapter from 2010, co-authored with Jana Tabak, so professor from University State of Rio de Janeiro, called Discussing Global Health and Access to Medicines in the UN System, the case of the Union of South American Nations, UNASUR. That was a book, chapter of a book called Group Politics in the UN Multilateralism by Karen Smith and Katie Verleiken. And the other one is an article published in 2021 called to Andrea Biancoli from eBay, who's also a member of a coordinator, member of this Jean Monnet, called Institutional Overlap and Access to Medicine in Mercosur and UNASUR, 2008-2018, Cooperation Before the Collapse. And finally, ongoing book chapter published, co-authored with Beatriz Nascimento as well, about health and pandemics in regionalism, and Latin American and Caribbean regionalism. So to put shortly then, I mean, I've been working with those topics for some years now, especially from a framework of comparative regionalism. So studying how these region organizations in Latin America and the Caribbean have dealt with a certain of social issues, and among them health. And in the case of health, there is this trend that I think we can observe of a certain tradition of a health-based approach. Therefore, I'll be talking about it. In terms of periodization of time, I think it's also important to say that there is a tradition of health cooperation in Latin America and the Caribbean that dates back actually to the creation of the Pan American Health Organization in 1902, that including also North America then. And from then on, after the creation of the United Nations and the Regional Commission of Economic Commission, CEPAL, based in Chile, by the way, of course, Tatiana, there is a very strong tradition on cooperation among Latin American and Caribbean countries about health. That said, I mean, I think it's more recent, this idea of health as a human right, so a social right and therefore a rights-based approach to development, in the sense that especially since the 2000s, when we say that we called in the literature at least a certain revolution in global health, where you had a lot of global level initiatives. You had very important to mention here, like in 2000, a resolution from the ECOSOC in the UN called General Comment on the Right to Health, and also a resolution on intellectual property and human rights in the UN Subcommission on Promotion and Protection of Human Rights. You have a phenomenon called health diplomacy, with a lot of countries engaging in multilateral level, both global but also regional, about health. Because so far, until then, we could claim basically that, of course, it's a domestic issue. Some countries have it in their concept of welfare state, social right, health as a social right. Some others not. It's very diverse. Again, as I mentioned, some countries have a more private-based approach to health. And in the case of Latin America, despite this variance, there is this consensus that was building up after this 2000s and 2010, especially as I mentioned with the creation of UNASUR in 2008. You have this building consensus that health is a social right, that it shouldn't be dealt with as a service or only handled by the private sector. And in some constitutions, such as the case of Brazil, where I'm based, it is a social right. There is a universal open access to health. Of course, it's different to say that the country can deliver that. The implementation is a different issue, but it is framed as a right, not as a social right. And again, in several other constitutions, it changed in the last 20 years. There's a lot of political polarization, government changes, and social rights are one of the issues that sometimes also face different framings, even constitutional changes. So I cannot cover all these here, but just to mention that there is this, we could observe this trend. And also link it to the Agenda 2030, where you have I noted down here again, 8 MDGs, later SDGs, indicators related to health, very specific, HIV or child maternal health, but also broad, like the definition of health as that to handle health, you have to frame it as a social issue. Therefore, the social determinants of health are very important. So we can see here that health is connected to a series of elements linked to development. So it cannot only be a question of a service, of having a doctor or a specific medicine. Different diseases are located in different parts of regions, depending on the level of poverty, if you have access to water, if you have sanitation. These are all the social determinants of health, and therefore you cannot have an exclusive take on health, looking only as a disease that in a certain moment you have to provide that service. Again, that doctor and that medicine, you have to look at from a broader perspective. So this is all being discussed again globally and regionally, and in region organizations, in so-called regional cooperation or integration organizations in South America, that we can, for instance, the Andean Community, Mercosur, or Pacific Alliance, ProSur, I mean, more recently created, but I'll be focusing then also on UNASUR, because UNASUR is a paradigmatic case where there was very explicit. Of course, this UNASUR, like the South American Cooperation Organization, it's currently fragmented and it's not very active, but again, it's a paradigmatic case. But I think that the peak of this look at health as a social health. And then you can see also the limitations. Now, the fact that this organization was not only about health, of course, but it was a strong component. It had two very strong components, security and defense, which other regional organizations do not have, and health. There was a social institute of health that was based actually in Rio de Janeiro, the seat, and where there was a lot of not only it was a bit of a think tank, but also capacity building, and health was then framed there as a social right. And again, the fact that NOHASU is not active anymore shows the limitations of this ideal, the framing of health, and sometimes the capacity of governments, but also social actors, civil society, companies, etc., to hold on to those, to law, no? In effect, to those rights commitments. And in the case of this health council that was created then in 2008, we can see again this approach, a focus on, of course, specific health issues, tropical diseases, but very importantly, the idea of universal access to health, to medicines, to health, and also to medicines. And again, the promotion of social rights in the social determinants. And I'll focus a bit on the question of access to medicines, because that's the object of one of those articles that I mentioned, because that has been a very important issue in the region, I would say, in Latin America and the Caribbean, because these are mostly global south countries. Of course, some countries that are least developed, some highly indebted, if you think about Caribbean, some more developed. Brazil is, of course, very unequal internally, but it's not a poor country. But this topic of access to medicines was very prominent during those 20 years and also during the pandemic. And that's why I wanted to refer to it, because it shows also the importance of having the right to those medicines. Now that when you have not only these tropical diseases or issues like malaria, but when you have a pandemic and you don't have that right, very easily you can see the distribution of medicines, for instance, are directed very unequally. And therefore, in this research, again published in that article, but also this last chapter that I mentioned, what we can see is that the idea, if you have a right to health, it means, again, not only that you have this complexified vision of health with the social determinants, but you do have access to the medicines as well. And as we know, medicines the pharmaceutical industry is a very powerful, I would say, in a sector globally, but also regionally. And there has been a standing discussion about what do you do when you have those moments that you need huge amounts of medicines. And we had that in the case, or very expensive medicines. That was the case of the HIV, when in the region a group of countries managed to break the patent, for instance, for the medicines to HIV. And that case, that was discussed in the case of the pandemic too. And then we see how, I mean, in the end, in the case of the pandemic, we didn't have enough anymore, and the region was fragmented, so that it was difficult to have a common platform to bring that. It was fragmented, but when we see that in those moments, it's where actually, if you have those rules and those norms working and stabilized, you can use them. And in the case of before the pandemic, even the case that we treat in the article, we can see that the research we did is that those region organizations, but that including Mercosur as well and the Andean community, they attempted to do to negotiate jointly. So if you have a necessity to buy, for instance, medicines for organ transplantation, there is some very expensive medicines when you have transplant to the adaptation of those countries that have public services, they buy those medicines from companies, and they buy at very different prices. So what, for instance, Mercosur and the Andean community did is to negotiate, to try to, first of all, share the prices that they were buying. That requires a lot of cooperation already, like that the public institutions that are in charge actually of buying those medicines, that they share those prices. And in some medicines, and that's in the paper, the prices were hugely different, sometimes more than 3, 4, 5 times. And very often the smaller countries were paying more. And that's why we see that regional cooperation is important, because by joining forces, now, of course, they have a bigger market. And since these are medicines being paid, being bought to the public services, this is basic public money from taxes going to big pharmaceutics. And so, again, these regional organizations, by framing health as a right, were able to foster some other kinds of cooperation, including that, doing these price banks, and in some very few cases, because this is, of course, as you can imagine, there's a lot of opposition to those attempts. They managed to buy some medicines. And again, that's one example. And just to conclude, I'm looking at my time, but of course we have plenty of time for questions later. What we also have in the social determinants is, again, this combination, this attempt to combine health and even climate change now, because a lot of health problems currently, they derive, or there's also expectations that it will increase. So if you have pollution, if you have waters polluted or changed in their even like clear waters from rivers, after floods, they are also already not proper to drink. So you do have a lot of topics that are being more and more. Therefore, health, it's a very complex discussion in terms of how you can provide from this rights-based approach to development those issues. So I'll stop here. I think we can react later to questions and bring some more also topics to discussion. Thank you.
Thank you so much. I was looking for my unmute button. Sorry about that. Thank you so much, Andrea, for this contribution on, let's say, the diverse approaches, I guess, to health as a social right, as a human right, even within, let's say, Latin American, Caribbean region, and how, I mean, obviously, recent developments are, let's say, testing the way in which that countries will, let's say, keep on framing this as a right, and how this actually will affect, let's say, individuals' access to medicines, and also, I think, let's say, underscoring the importance of understanding that this is a comprehensive issue with a lot of different aspects, and not just about access to, let's say, services of doctors and hospitals, but it goes way, let's say, beyond that. Now, for our second speaker, I would like to invite Professor Tatiana Rein for her contribution, which will be, as I've mentioned before, focusing on women's rights and the threat of conservative policies in the Americas. Please, Tatiana.
Thank you, Philip, for the introduction and for the invitation. I will read because I don't feel so comfortable with my English anymore. So I felt better to have it prepared. So I have called my presentation Backlash for Women's Rights, the Threat of Conservative Policies in the Americas. The 1980s and the 1990s mark a decisive moments for the advancement of women's rights. Although the recognition and international work for women's rights began earlier, the most determined advances and the connection with human rights theories began with greater emphasis in the 1990s. Thus, in 1975, the first World Conference on Women was held, and in 1979, the Convention on the Elimination of All Forms of Discrimination Against Women was adopted. However, during this year, several countries in the region were experiencing periods of dictatorship and were not particularly interested in advancing the protection of women's rights. In the international arena, the 1990s were decisive in linking human rights and women's rights. A milestone in this regard was the 1993 Vienna Conference on Human Rights, which recognized women's rights as human rights, implying a responsibility for the state to advance them. On the other hand, the 1995, the Fourth World Conference on Women was held in Beijing, representing a commitment by government to advance equality and women's rights, with mechanisms and strategies to move forward. In particular, one of the significant advances of the time was in addressing violence against women. The first way that the states in the region addressed this problem was concerning domestic violence, adopting laws today known as first-generation laws, which were adopted in 1990s. During this time, the Belém do Pará Convention of the Americas was also adopted, especially aimed at preventing and eradicating violence against women and being the first international treaty on this issue. After 2010, countries in the Americas began adopting second-generation or comprehensive laws against violence against women. And in the same area, by 2022, 16 countries in the Americas had adopted laws against femicide, the most extreme form of violence against women. Between the 1980s and 1990s, Latin American countries began establishing women's policy agencies. For example, in the Southern countries, Argentina, Brazil, Chile, and Uruguay, these agencies were established after the collapse of militarist dictatorships. These structures started as lower-ranking offices and became ministries in several countries of the region, such as Argentina, Chile, Brazil, Costa Rica, Ecuador, Guatemala, Honduras, Panama, Peru, and among others. In the realm of political participation, the first country in the continent to incorporate a quota law was Argentina in 1991. Mexico and Paraguay followed in 1996, Brazil, Panama, Bolivia, Ecuador, Peru, and the Dominican Republic in 1997. Currently, the Americas have the highest percentage of women in parliament, with 35.7%, which is very important, but it's not 50%, and does not translate into representation in all areas of political representation. Progress has been made, but it has been quite gradual, and the advances have taken decades. Regarding reproductive rights, there has also been advances. Teenage pregnancies have decreased, access to contraception is quite widespread, and many countries have decriminalized abortion. There is significant disparity in the continent. For example, the poorest 20% of the region had 50% of maternal death, while the richest 20% have only 5% of maternal death. On the other hand, only some states have adopted the comprehensive sex education laws. The advancement of women's rights, both globally and in the Americas, has not been without difficulties. It has been slow progress with multiple setbacks due to budget cuts or changes in government orientation without a commitment to this issue. Gaps persist in all areas. There is a wage gap in all countries, violence against women persists in all. Most still have differences in decision-making areas, and women face difficulties in terms of caregiving tasks and the overload that this generates. However, the advances are significant, and it is essential to maintain them. In recent years, conservative governments have come to power without a commitment to women's rights and without a directly anti-rights agenda, resulting in the closure of mechanisms for women advancements, prevention and attention to violence programs, among other setbacks. In particular, in recent years, politicians with conservative and anti-rights discourses have come to the presidency of some American countries, such as El Salvador, Brazil, Argentina, and the United States. They come with an agenda and discourse that attack women and equality, as well as dissidents. They are based on the idea that feminism threatens traditional rights, such as family and religion, and argue that a gender ideology is being promoted. This last concept is used to summarize what is perceived as threatening the moral values of society and will explain a decline in its institutions. These sectors have strengthened due to the perceived threat from the advancement in the recognition, inclusion, and strengthening of reproductive autonomy policies, particularly certain rights such as abortion, equality, equal marriage, same-sex adoption, sex education, among others. There is a cultural clash where we can move forward or backwards in the advancement achieved after years of struggles. This time of offensive is larger and seek to eliminate the policies achieved definitively, but also to achieve a cultural change that in the long run allows maintaining conservative policies over time. With these approaches, these governments have adopted policies that are resulting in a setback in the rights achieved thanks to a long struggle for equality carried out by women. Some examples of policies that eliminate advances in women's equal rights are as follows. In Argentina, the Ministry of Women, Gender and Diversity was closed. Also, the Undersecretariat for Protection Against Gender Violence. Inclusive language was banned in public agencies. Efforts are being made to eliminate comprehensive sex education, and attempts are being made to defund various policies promoting equality. Hate speech against the LGBTIG plus community is also being promoted. In Costa Rica, sexuality and affectivity education programs were eliminated, and there is a project to total penalties for the crime of abortion. In Peru, the focus on women was changed to a focus on family. Minors are being denied abortion. There are proposals to penalize false reports in cases of violence. Affirmative action measures such as alternation and equal participation have been rolled back. The use of inclusive language have been banned, and trans people have been prohibited from entering women's bathrooms. In Ecuador, the Ministry of Women and Human Rights disappeared and became part of the Ministry of Government. In Brazil, the Ministry for Women changed its focus to the family, and during Bolsonaro's presidency, it established a series of measures to make it difficult for victims of sexual violence to access abortion. In El Salvador, the use of inclusive language in schools was also banned. In the United States, Trump ordered changes to gender and diversity policies, recognizes only two sexes and establishes that they cannot be changed, establishes that the concept of sex does not include gender identity. Gender policy funding was cut. This has resulted in several companies such as McDonald's, Walmart, Meta, ending or reducing their gender and diversity programs. He has also pressured universities to adapt his specific guidelines, which are not only related to gender, but are closely linked to human rights. Also in the United States, since the first Trump administration, funding for organizations offering service or information on sexual and reproductive rights has been banned, affecting both non-governmental and governmental organizations, both in the United States and abroad. The current backlash is not limited to setbacks country by country, but is a transnational phenomenon involving alliances of conservative political groups with evangelical churches and more conservative sectors of the Catholic Church, in addition to global articulation. There is not only a reaction against specific measures, which has always existed, but an expansion towards a broader set of rights, putting the very concept of gender in public policies under tension, generating a conservative backlash with an anti-rights focus whose impact is more significant. And we still don't know the long-term impact it will have. So this is my presentation. Thank you very much.
Thank you very much for this comprehensive overview of let's say, on the one hand, let's say the rise in protection of women and the very idea and notion of, let's say, linking women's rights to human rights, and the advances that has brought, but also I think equally important and alarming is, of course, the series of setbacks that we have suffered in recent years. And of course, you're very right to say that this is not just a Latin American phenomenon, but something that, or an American phenomenon, of course, including the examples you gave from the US, but something that is as much broader and ultimately, let's say, wants to have more general, let's say, change of general, say, approaches towards women's rights, and that's of course a very alarming evolution as well. I have in the meantime, by the way, heard from our third speaker who informed me that she was not able to join us because of a family emergency, and of course we completely understand that. So this means, of course, that we do now have a little bit more time for discussion with our two speakers. Let me first of all check for any comments or questions from our audience members. Also, of course, I have a number of questions myself that I wrote down during the presentations, which I'm very happy to jump into. So maybe first, I'll ask, let's say, one question to each of our panelists, and then we can use that as a platform for our discussion. So we have about 20 minutes left for this webinar. My first question, so that's directed to you, Andrea. Let's say you mentioned your analysis touches on, I guess, the, let's say, growing intersection between, if I may say it so, like the health and other policy domains. And of course, you singled out then issues like climate change and access to medicine and how that all connects with the social right of health. Do you see Latin American regional initiatives contributing any, let's say, distinctive ideas or practices that could influence global debates on the right to health? For example, you gave the issue or the example of pandemic preparedness, or at least, let's say, the ways in which regional organizations could leverage their power to essentially increase, let's say, or have lower prices for essential medicines. That then you didn't specifically touch upon that, but presumably also was translated and repeated in the face of the pandemic. Is there anything else, let's say, that you think this is a regional approach that is maybe particular to Latin America and Caribbean countries that could influence, global debates on the right to health, and in particular because this, of course, the EU-VALUES project, if this type of experience maybe could also inform the EU's own approach to integrating health within a broader human rights-based approach framework. Maybe I'll ask that question and let you think about that for a second, and then I'll already ask my other question to Tatiana. So here, and that's picking up on your last point. You point to the emergence of, let's say, transnational conservative alliances, right? That's you mentioned they're not only reacting against specific feminist policies, but they're really, let's say, contesting basic notions, basic concepts. How do you see this movement kind of reshaping potentially global human rights discourses, and what implications do you think that has for international cooperation frameworks, like with the European Union, how that may ultimately affect, let's say, cooperation with the European Union? Do you think there's like room for a renewed dialogue, I guess, between Latin American and European actors to kind of collectively address this global conservative turn against women's rights, if I may call it that? So hopefully those questions were clear and not too difficult, but maybe allowing you to kind of launch into a discussion. So please, Andrea, if you could address the first question.
Yeah, sure. No, thank you very much, because in fact, as I mentioned, the latest publication that's from 2025, we addressed directly the pandemics. No? And that's where, as I mentioned as well, we see the limitations of Global South countries, or in the case Latin American, Caribbean countries, to fulfill the expectations of the rights that they include in their constitutions or their regional organizations, because in fact, what we saw during the pandemics is linking actually with Tatiana's presentation, is in the case of Brazil, the peak we were in the middle of Bolsonaro's government, which in addition to be anti-gender, LGBT plus, etc., was also a climate negationist and science negationist. So he negated the existence of the virus, and well, I could talk ages about that, but the fact is that the country didn't, I mean, for at least a year almost, it didn't do anything like based on science or the recommendations. Obviously, I mean, and he's not in government anymore, that's showing that not even the population, or certainly the scientific consensus in the country, as in the other Latin American countries, agreed with that. So again, that only makes the point of the intersection between not only health and also policy domains, where the democracy is stronger, because you can have the constitution, you can have the rights, you can even the experts. Even a resistance to Bolsonaro was among experts in the health sector. So in the case of the North, governors, not the subnational level governors like the provinces in some countries, they create their own medicine protocols. They implemented in the hospitals the protocols that were the consensual in the world at the time, according to WHO and other. Denying and actually being in the resistance against the government, running their risks even, because they didn't apply the protocol of Bolsonaro, which was, I mean, to use this chloroquine, this medicine that was proved not to be effective at all. So just make that point that that problem, that if you think about health, even a rights-based approach to development, broadly speaking, on health, it also depends on the democratic stable system where those health and those rights are implemented. So to put it in a more positive note, perhaps, what we see is that after, we still have a lot, as Tatiana said, we still have a lot of governments that, certainly in the case of human rights or women rights, this is still a problem. In the case of health, perhaps not as central as during the pandemic, but and Bolsonaro, not all far-right governments were necessarily negationists of science, as it was the case then. But on a more positive note, as I mentioned in this latest article from 2025, what we explored was exactly, so how are countries preparing to a new pandemic? And there we see a mix of rights-based approaches. In the chapter, we focus also in Latin America and the Caribbean, but we also have other regions. So it's a comparative regionalism. We also look at how in Asia, for instance, because regional organizations in Asia, and I'll follow the next webinar about Asia, they also had a long tradition, because they've had SARS, they had a lot of pandemics before the COVID pandemic. And so how are these organizations preparing, to what extent, which mechanisms, and what we see there, the current trend is actually less of a rights-based approach, but more a multi-stakeholder cooperation, including also WHO, but also other actors, including pharmaceutics. So what we can say, perhaps the consensus on the global level maybe lean towards a more inclusion of those actors and less a rights-based approach to health, which is, again, on my perspective at least, that's the point we make also in the article, on one hand problematic, because in the end, especially the poorest countries, where the private services are not even offered in the poor areas, that's the case in Brazil, that we can have top private access to health in the big cities, in the capitals, but if you go to the interior of the country or in poor regions, very often you don't have that. So if you don't have the public access to health and to medicines, and subsidized sometimes prices, in the case of some countries, such as in Brazil, have a policy that make some basic medicines cheaper. So you do simply, these people die from very simple diseases sometimes. So again, that's, I would say, the more recent trend. And I just want to include also to expand a bit from your question, the intersection with climate change, and to mention, because that's something I'm working on, and this Escazú agreement that was it was signed in 2018 and it was enforced in 2021. It's a very good example of a rights-based approach, in the sense the treaty is more about climate change, but it has a lot with health. So again, maybe against this more broadly trend that we see now, but it's still an example of how in Latin America we have some persistent, I would say, attempts to forge a rights-based approach. So this agreement is called Regional Agreement on Access to Information, Public Participation in Justice, Environmental Matters in Latin America and the Caribbean, Escazú Agreement. And again, in the environment-related diseases, it has a lot of health. But again, it depends on the countries who signed it, ratified this agreement, even the countries who have those rights already in their constitution sometimes to implement them. And here I think it's the last point I want to make about the necessity of international cooperation, because you do have countries who have those capacities, perhaps financial resources, capacities, even pharmaceutical industries at the global, at the national level, but some others not. And so we see the necessity of cooperation in that, to implement those rights. And again, compatible also with the Agenda 2030.
Mm-hmm. Could you, you referred to the Escazú agreement, if I pronounced the name correctly. What's the current status? You mentioned that there's issues, of course, concerning implementation and ratification. Has it widely been adopted, or is it?
Yes, in fact, unfortunately, my own country didn't ratify it yet, but it has. I have a list. I mean, I can look at here. But in Latin American Caribbean countries, now that they are open to Latin American Caribbean countries, I think about 70% of the countries. I even look at recently. I'm opening here the file. And we are focused because in the case of Brazil, it's not. There is a campaign for the ratification because it was signed during Bolsonaro, so in a way it stayed there. But what I didn't see, but CEPAL has a platform, I didn't look at it now, of cases that can be already being used because they have a database of not only the ratifications, but how this treaty has been cited, mentioned in national level courts, for instance, because it doesn't have its own court. No? It's a treaty. It's a human rights-based treaty at the regional level, but the national courts have to refer to it. It's not that it has its own court. And so I don't have this updated table, but yeah, you can check it at the CEPAL website, and perhaps there are some already research analyzing that. That's a good question. Yeah.
Yeah, it's nevertheless very encouraging number of ratifications, especially in these times of increasing difficulties. I'm a lawyer myself, so to actually get countries to agree on, let's say, new treaties, or let's say at least cooperative binding agreements. So that's actually encouraging to hear. Then Tatiana, I'm not sure if you've had the opportunity to think about the question that I asked, which was, let's say, more about considering, let's say, the conservative alliances that we see erupting that are setting back feminist policies or women rights policies. The question is, considering also the European Union and the fact that the EU likes to position itself as a promoter of women's rights, if there perhaps is a chance for a renewed dialogue, between Latin American and European actors to collectively address this more global conservative turn.
Yeah, sure. I think we need all the actors possible because I think this is an agenda that has grown, and before it was not focused on human rights organisms. It was like more focused on the policies in every country. But now it has focused on the human rights agenda, which is quite more dangerous because it can make a backlash very important. So they are trying to integrate the Inter-American Court of Human Rights, and they are doing it. The Commission and other organisms like the OEA, so OAS in English. So because of this, they are having a bigger impact. I haven't seen yet that we are doubting about the treaties that we have. So we still have, we are more stable, we are stable still in that area. But in every countries where they are moving and doing these policies that are affecting women's rights. And if we don't agree, if we don't make a dialogue and we decided how to confront these policies, we might see a very important backlash in all our countries. So I think it is important. I think, okay, women, organized women are seeing this and they are mobilizing occasionally. With the Me Too movement, this was very important. But now I don't see a big mobilization, and there is this agenda that is going on and penetrating in these organisms, and they are cutting funds, which is also very important because sometimes you have people that want the advancement of this agenda, but then there are not funds. For example, with the first Trump administration, he cut funds for every agenda that had to be with abortion, and we couldn't do anything. Like we had to stop this agenda. For example, in the Organization of American States. So it's very difficult if they start cutting these funds and you just have people that want to do something, but they cannot do it. So I think this is a big place in order to start a dialogue, not only in American States, but across country, across ocean.
Yeah, thanks so much. The final question, because we only have 5 minutes left, is one that I would like to ask to both of you. And obviously it kind of draws on health as a gendered right. Obviously, we've heard from both of you that on one hand, there's important social determinants of health, and Tatiana, you also showed how gender inequalities persist in caregiving, access to services as well. So obviously these two are very closely connected. And I'm wondering, it's mainly, I think, a question that's born out of my own ignorance, but it's very interesting to see that there are such, let's say, dedicated regional cooperation mechanisms in Latin America, such as the Pan American Health Association, or in America in general, obviously, but also that there's within Mercosur also such a focus on health. To what extent do these regional organizations currently, let's say, employ and integrate a gender lens into regional health cooperation? And is this also something that you think let's say, we should focus more on, or if, let's say, the conservative backlash against anything related to, let's say, gender would make it even more difficult to, let's say, retain that gender lens to the extent that it currently exists? So, in other words, do these regional health corporations actually look at health cooperation from a gender lens? And if they do, is it also under attack? And if they don't, do you think it's a good idea to, let's say, increase that the gender integration into health? Either of you that wants to take the question, please go ahead.
They are supposed to do it. From 1995, all the development agenda is supposed to be it's supposed to have integrated the gender agenda, and every policy on development should include gender. So from international organisms that do development, they focus or they have this gender agenda. Okay, I wouldn't say always, but there is the mandate to do it. At the national level, not necessarily. So I think in the international and in the specific organisms that do development, they do it. At the national level, not necessarily. We still have to work more on the pressure on the governments in order to integrate it. And if it's possible to have a backlash in that area, of course, because there are the funds. So if there are governments that are with conservative agendas and they do not want to have the gender agenda integrated in these areas, they will cut the funds, as Trump has already done it.
Yeah, thank you.
Just to complement, yeah, no, I agree. And the region organizations, the traditional ones, the community, Mercosur, they all have gender mainstreaming. They have gender mainstreamed their activities, again, exactly, I mean, from the early 2000s at least. But that's the question, how? Because there's a discussion about methodology, how you do that. In the case of gender in trade, for instance, has been a problem in terms of the implementation. I mean, there are some studies, but not agreement on methodology. Perhaps, as Tatiana said, the development corporations is a bit easier to have precise methodologies that you can check their implementation. But I also wanted to mention that in the case of health, there is on some countries, and that's the Andean countries, but also in the case of Brazil, also the not only gender mainstreaming, but intersectionalities mainstreaming. In the case of Brazil, that's very the case. Like when you look at the social determinants and the vulnerable populations, you have definitely to take into consideration also the ethnic and race into the vulnerable population. So, I mean, it's a new topic in terms of how you can mainstream that in so many policy areas. But in terms of the rights, it's most of the cases there. I mean, you do have these regulations and resolutions, declarations, that it should be mainstreamed, and definitely in health, where it's very directly related, absolutely, to both gender and ethnic and race questions. Absolutely.
Okay, thank you so much. I believe this is all we have time for today. So just to close, I want to thank you again so much, Professor Andrea, Professor Tatiana, for your contributions on diverse, but obviously also, as we've seen, intersecting topics. Also, thank you in the audience for joining us for this second webinar. So, as mentioned, this is the second in a series of 4, meaning that we now have 2 other webinars scheduled with 2 different regional perspectives, so from Asia as well as Africa. Our next session will turn specifically to African perspectives, exploring how human rights-based approach is understood and implemented across the African continent. That is scheduled for Monday, the 27th of October. It's in Central European time from 2 to 3 p.m. So I believe for Buenos Aires and Rio, that is at 2. No, wait, that's early in the morning, right? That's
9 o'clock. Yeah, not that early. It's already work time.
That's all right. So people from Latin America can have no excuse not to join. So so we'll hope, of course, that you will join us again for this discussion as well. And thanks again for your contributions, for your participation, and have a wonderful afternoon for you.
Thank you.
Thank you very much. Bye-bye.
Bye.
Bye.